For the final observation checklist, we'll be looking at applying nursing practice in the primary healthcare setting. This will require you to analyse health information regarding that person to reach appropriate conclusions on possible nursing interventions related to primary healthcare needs. So we're really thinking about the community sector, so when the person's leaving to go back into their home environment, or it could be through a day program that's run in the facility. Alan David Lodge does have a transitional care program, which is a goal-orientated, time-limited and therapy-focused care that's provided to people after they leave hospital and before they return home. So it's like a bridging step for them to take as they move towards heading home and gaining their full independence. When we think about nursing interventions that they may need in that primary healthcare setting, things like community health nursing or district nursing might be required. They may require additional allied health support such as physio or OT. They may need Meals on Wheels or food services. They might need some assistance with domestic cleaning, that type of thing. Or they might need someone to come in and help with their activities of daily living, personal care. Alternatively, not a nursing duty, but something we need to be considering is will they need help with their shopping, their transport, their respite? So having all these things to think about, we're considering them when we consider how that person will be able to reconnect when moving back into the community setting. We also want to ensure that they have appropriate understanding of their health issues and that when they return home that they're able to better manage their illness and continue to have preventative health implemented. This might be as simple as returning to their GP to have a review when they're returning home, as well as speaking with their pharmacist about any new medications that may have been commenced. If you don't get an opportunity to care for a patient who is transitioning into the primary healthcare setting, such as the transitional care program, the facilitators will look at opportunities to give you exposure to that program, as well as potentially provide simulation opportunities where you can discuss the care of a person who is in the primary healthcare setting and develop appropriate nursing interventions for that particular person. Every effort should be made to achieve this whilst on their aged care placement, but if a student does not get an opportunity to complete the assessment, then they will be undertaken at subsequent placements. Satisfactory completion will be noted here and the feedback will be provided by the supervisor, where the student can also again provide a response.